Welcome to this episode of the Measure Minute. This video will discuss the two HbA1c control measures for patients with diabetes. This measure includes patients ages 18 to 75 with diabetes. To determine if a patient has diabetes, this year and last year's claims are evaluated. The patient can qualify for the measure in one of two ways. First, the patient will qualify if they have a diagnosis of diabetes on 2 or more dates of service during the 2-year claims period. The second way is when there's at least one claim for a diabetes diagnosis, along with a pharmacy claim for insulin or an anti-hyperglycemic medication. You'll note that this is an updated definition for 2024. Previously, 2 pharmacy claims would place the patient in the measure even if they did not carry a diagnosis of diabetes. Patients are excluded when they begin receiving palliative care or hospice. You'll note that commercial plans measure control as the most recent value less than 8. Medicare plans, including red, white, and blue, and MA, measure control as the most recent value less than or equal to 9. The A1C control measures open at the start of the calendar year or once the patient meets the inclusion criteria previously discussed. The gap will close when a controlled A1C value is reported. The gap will reopen anytime a new lab claim for an A1C is reported with either an unknown or an uncontrolled value. Starting in 2024, this gap will also be able to be closed with a controlled GMI value from a continuous glucose monitor. CPT-2 reporting provides the payer with the most recent A1C value. Please note a CPT-2 code should not be used to capture a value from the prior year, only the most recent value in the current year. The UHN quality team supports the closure of this gap by reviewing new A1C claims that come in without a reported value each week. We look for the results in the EMR and in Ethan, and we report the value to KPI Ninja and to our payers. We also request missing records from endocrinology. Open gap data for your patients can be found in KPI Ninja and on the UHN point of care reports. These reports include 3 open gap reasons to help practices know next steps. The first reason is no HbA1c. This means that UHN has not received a claim for any A1C lab or value in the current year. Practices can make sure that patients are scheduled for labs or notify UHN if a test has already been performed. For example, if the patient gets their labs through the VA, then UHN would not have a claim for the lab. The second open gap reason is no HbA1c result. This means that UHN was not able to locate the result for the most recent lab claim. If the practice has the result, they can notify UHN. If they don't have the result, they can request the medical record from the billing provider. The last reason is the most recent result is an uncontrolled value. Practices can ensure the patient's schedule for follow-up labs. You can also consult the UHN pharmacy for assistance with medication management and the UHN care coordinators for patient education. Hopefully, this will help the patient have a controlled result prior to the end of the year. Thank you for watching this video. If you have additional questions or need more information, please reach out to us.